thank you for that. Can I hand straight over to Becky, please? Thank you.
Thank you, Chair. So thanks so much for being here this morning. I just wanted to ask some more about the neighbourhood health centres and the family hubs. So, Minister Dalton, you've already outlined the fact that there will be some overlap, but I just wanted to probe a bit and see how you think pragmatically those two things are going to work together, how the services are presumably going to complement each other and where they might be distinct, and perhaps if there might be gaps that you can see that might need addressing. That'd be great.
Okay, so the neighbourhood health services, I think it's really important, and I've been doing a lot of talking about neighbourhood health services since we launched the 10-year plan. It's not a thing, it's not a building, it's services, and it's about making sure that people have got access to their health services as close as possible to their home or to their community. In some instances, that might be delivering it through a family hub, which is more of a thing, although in some cases it's not necessarily a thing. It can be, a virtual service or whatever. So through local commissioning, we're making sure that neighbourhood health services work in partnership, not just with family hubs, but also with schools, with nurseries, with colleges, so that we're making sure that timely support to children and their families is accessible as close as possible to where they are. We're currently working up further details of how we're rolling out the Neighbourhood Health Implementation Programme, and they will come out in the coming months. But fundamentally, it's about saying all of our health services for everybody from conception to death are available as close to the community as possible. Now, that will mean, in some cases, linking with family hubs. It might mean linking with existing services such as community centres, mother and toddler groups, all different kinds of things that are in different communities. And what we're recognising with the neighbourhood health programme is that all communities are different and have different levels of assets. And what works, for instance, in a very urban city centre environment is not necessarily going to be appropriate for people in a more rural environment. So the commissioning should ensure that those neighbourhood services reflect the needs of the neighbourhoods.
That's clear, thank you. And just to look at the commissioning then, so with the neighbourhood services, as I understand it, it may well be a primary care provider that takes on that provision or another provider. So if the neighbourhood health services are commissioned from the ICBs, the ICTs, and then you have your family hubs, which are a separate entity. If I've got a 2-year-old and I'm phoning up the family hub, presumably if it's not appropriate for what the family, for what I need for that 2-year-old, then there will inevitably be that direct communication where the family hub, even if they're not physically together, they'll go, okay, we're going to refer into the other commission services.
Absolutely, yes.
Okay, so that's clear, that's fine. So if I can move on to how you decided to come up with Best Start Family Hubs. Lots of words come together on different things. Okay. Best Start Family Hubs. So as I understand it, there is an ongoing evaluation of the predecessor of Best Start Family Hubs, which is Family Hubs and Start for Life. But that evaluation is not due to report until 2026. So could you perhaps talk us through what evidence you used to decide to integrate the services prior to that evaluation into Best Start Family Hubs?
Yeah, yes, we had the previous service, and we, as you've identified, we're in the middle of the evaluation of that, and that report's next year. So we're expecting to see that. What we're about here is making sure that we're joining up. This is a mission-led government, so it's about making sure that government is joined up and not siloed. So again, it continues as a joint project between the Department for Health and Social Care and the Department for Education. So essentially, a lot of the services are the same, but building more on the lessons of Sure Start. And you could probably talk a little bit more about how the Department for Education has looked at what it's prioritising and how to bring those things together in the rollout of their programme.
Yeah.
So probably the most influential piece of research that's been done in recent years is the work done by IFS on Sure Start, looking at the long run impact. So that's been hugely influential, and it's obviously made a huge difference and impacted on how we've designed it. So taking that evidence of what it showed really benefited those children. It was the way that the research was done was looking at how close a child lived to a Sure Start centre rather than whether they accessed it or not, and then looking at population level to find out. And we saw through that children performed significantly better in educational assessments at age 7, 11 and 16. The proportion of children achieving 5 GCSEs at grades A star to C increased, and also importantly had a really interesting impact on hospitalisation. So increased them for 1-year-olds. We predict hypothesis through greater identification of need, but it averted over 13,000 hospitalisations for 11 to 15-year-olds. So all of that, understanding how that was done, and what we also looked at was how Sure Start was rolled out. So if you remember, it started off with Sure Start local programmes, which were located in the most disadvantaged communities. Over time, the model changed slightly. The IFS work was predominantly focused on that Sure Start local programme, which, as I say, was very targeted at disadvantage, which has informed how we're doing the national rollout for Best Start Family Hubs to look at that. In addition, the model also has been informed by some work that was done in Doncaster, who had adopted a Family Hubs model prior to the Best Start Family Hub programme, which again showed important improvement in outcomes for children at age 5 that had attended the Family Hub. So we drew on that. And as the Minister says, we've got, and you said, we've got lots of valuations ongoing to look at it. We know that the impact of these sorts of programmes is long run. You can't see an impact in a year or 18 months or 2 years. It is that long run work to look at how it affects the lives of children and families as they grow, which is really important. Hence why we are evaluating, but we need to interpret things cautiously. We need to understand what the data is telling us and what it's not telling us, to inform how it's being rolled out. But at the heart of it is the integration across education and health, which obviously was a key factor of the programme when it was first initiated back in 2021.
Yeah, thank you. So that's really interesting. So am I hearing right that basically you've taken the sort of the footprint of Sure Start and the data and the evidence that Sure Start have given you and built up from that with some additional input around some Family Hub pilots that happened in Doncaster, is that right?
Yeah, and the other thing I would add is the interventions that we also pay for, whether that's the Department for Education Services or health ones, are also informed by the latest evidence. So we obviously have work centres that have looked at the effectiveness of parenting programmes, of evidence-based interventions. So it's both the model of how the services are integrated and then what you are choosing to do with the families once they come in, and that's informed on an ongoing basis by research coming out of people like Nuffield, Nesta, What Work Centres, EEF, etc., that really help local authorities to make the right commissioning decisions for their local populations.
Great, and just one final question from me. If I suspect it won't. I don't think the data will contradict massively what you're saying. And as you say, it's ongoing data collection. But presumably when this evaluation reports next year, there's flexibility in the model to be able to adapt and move forward depending on what it tells you.
Yeah, we've built test and learn into the new model as well, really, really clearly. So we've already done 2 test and learn pilots in Sheffield and Manchester. That's particularly around outreach and how you ensure those underrepresented groups or seldom heard groups are really targeted. But we're building test and learn into the approach for the whole model. So we're really encouraging local authorities to think creatively about their approaches but share that learning across the system, so have better ways of, so-and-so have done it over here, does that apply to my area? Because that's what commissioners need. We don't want to prescribe exactly what they should be doing everywhere, but we do want every local area to be informed by the best practice as it applies to them.
Right, thanks. Thanks, Chair.
Thank you. Thank you for that. Go straight over to our Becky. Becky, over to you.
Thank you, Chair. So I guess to sort of follow on really from data collection and sort of bring it hopefully to its sort of positive conclusion. During the inquiry, we had a lot of people giving evidence and sharing frustrations around the lack of a common outcomes framework. And as all three of you have rightly pointed out, that's health, education and children's social care. And for example, Alison Wharton, who's the CEO of Health Visiting Institute, actually said that she would like specific small numbers of key metrics that we want to share across these departments, and that it would be like a triangle, and that she doesn't mean wheelbarrows full of questionnaires, which is heartening. That's good. So I'm sure this is something that you've heard before, but I just wondered sort of across the departments, and as the Minister's pointed out, we are a mission-led government, what the sort of appetite is for a shared outcomes framework and whether any progress has been made.
Yeah, there really is an appetite for a shared outcomes framework, specifically, as you've identified, to integrate health, education and social care. The Best Start in Life strategy commits to exploring that. And I think it's also worth pointing out that separately, MHCLG are engaging with local government sector on a draft local government outcomes framework, and that will include the areas that local government is responsible for, including good levels of development at 2 to 2.5 years and at 5 as outcome measures. So the intention is that the framework will be publicly available by April 2026, but I know Susie will be able to speak more specific because the DFE are working on the shared national outcomes framework that we've identified for health, education and social care.
Yeah, so as the Minister said, I think it's a really good step forward that we've got that local government outcomes framework. That's a really clear target. The good level of development, both at age 5 and 2.5, is a broad-based measure that encompasses a range of things which we think is really important. So as the Minister said, that will be confirmed post the consultation, what measures will be in place by April 2026. We're also following up with individual local authorities, and we are setting individual local authorities targets around the age 5 metric in line with the 2028 Best Start in Life target for 75% of 5-year-olds to achieve a good level of development. And as I said earlier, we're requiring local areas to produce Best Start local plans, and that they should be building on plans that are already in place. We know many local authorities already have with their partners a clear focus on the early years, but we're just making sure that is consistent across and that those plans are in place. As the Minister said, we did in the strategy commit to looking at whether a more detailed outcomes framework is needed, akin to the lessons or drawing on lessons from Every Child Matters. That needs to be done carefully because, as Alison said, the danger of wheelbarrow and metrics for metrics' sake is something we need to avoid, and turning it into a bureaucracy, and make sure, obviously, when you decide what metrics to measure, that drives behaviour, and that can sometimes drive the wrong behaviour or have perverse incentives in there. So it does need to be carefully considered, but we think the local government outcomes framework is a really good starting point. We'll build on that to the Best Start local plans. I think, as you said earlier, or alluded to earlier, this whole programme needs to iterate and learn from what's working, and so that will be something that we consider rather than rushing to a much more detailed national framework, which could end up being quite a top-down bureaucratic process. So we need to get that balance right.
Okay, so that makes sense. So just the available outcomes data that you have, are they sufficient, or have you identified key gaps across sort of the 3 directorates or 3 areas that you think actually we need to look more at those?
So I can speak to the age 5, and maybe Liz or the Minister can come in on 2.5. So at age 5, every child is assessed at the end of reception year against the early years foundation stage profile, which covers a number of areas of learning. So that is a comprehensive data set, and obviously the vast majority of children are in reception and then take that data set. So we are confident that we have that data, and as I say, it is a broad-based measure, which is really helpful. Obviously, within that data set, we can also break down at a local authority level, and actually we're working to also produce a tool which allows schools to look at their data in more detail and compare it to schools with similar contexts to see how that's coming out. So we're doing a lot of work to give schools and local authorities the tools they need to understand.
Just one specific with that. So when you're looking at that, which is great when you're disaggregating that data, when you're looking at disadvantage in that area, are you using free school meals as a proxy?
We are.
Okay, and I'm sure you're aware that actually there are issues there, that it doesn't scrutinise non-working families, and that can cause real problems. So I don't know if you want to speak to the committee about that is a potential issue around that data.
Yeah, so it is the proxy that we use. We do also look at SEND as well, because there's big gaps in the experiences of SEND. So you're right, it's a blunt tool as ever, and that you'll imagine in every department there are lots of debates about how to measure disadvantage in the most appropriate way. When we've set the local targets, we have required that to meet their target they have to hit the overall target, but also ensure that the FSM children are moving at the same pace as the rest of the children. So I take your point that doesn't cover every
just the non-working families thing, because obviously just that very welcome announcement that we're going to fund childcare for working families. Great, but obviously we've got the non-working families now that we just need to be really mindful about that potential gap and how we're measuring that.
Yes, and obviously one of the big focuses on ensuring that those children that are entitled to the 2-year-old offer, which is 15 hours for low-income families, are all accessing that offer
absolutely.
and driving that through, and that will be part of the Best Start Family Service as well, to make sure that those families are being identified earlier, getting the support either through the Family Hub or, as I say, being referred onto settings where they're eligible for that entitlement. That is really, really key.
Okay, great. So you're aware of that particular glitch in the matrix. That's good. So if I can just ask about disaggregation of data, as Josh says, another very exciting thing, but it's important. So during our inquiry, we heard about waiting list times for children. Obviously the disaggregation at the moment for data looks at adults and children, but there isn't any further age-based disaggregation. So we did have Dr. Fuller, the Medical Director for Primary Care at NHSE. She did highlight that she thought there should be greater disaggregation to include early years to give greater insights, because obviously if you're 2 years old, waiting at 2 years old has a greater impact, or may have a greater impact than 16-year-olds. I just wondered what you thought about further disaggregation of those data, and whether it's possible, and whether you've considered it at all.
Yeah, I mean, obviously we've got our electives plan, which was published in January, and that sets the targets for an 18-week referral to treatment for all patients, and that includes children and young people. I think one of the big issues that you've identified is that actually being able to identify the data, and we've recognised that we've not been able to do that adequately. So we are putting in place a change to that so that we can report data on much smaller groups based on age, which is something that we've not been able to do in the past. So that's something that we're exploring, and we've put in place so far. I'm trying to remember which ones we've got in at the moment. But yeah, we are looking at that.
Okay, so I think it would be good if you can let the committee know when we could expect to see those data, that disaggregation, sort of when that might be possible.
Yeah, I mean, we are looking at that data so that we can monitor the waiting times by age, which we've not been able to do in the past.
Yeah. Okay. Great. Thank you. Thanks.
Thank you, Becky.